Good morning, everyone, and welcome to today's Pollard Health's Wellness webinar. It's a pleasure to have you join us today. At Pollard Health, we are really committed in ensuring that our members are really capacitated with all the tools and the knowledge that they need to take charge of their health and wellness. This is why we take seriously these wellness webinars as they are critically important to us. They do serve as a platform for knowledge sharing, as well as allowing us to demonstrate our commitment for being thought leaders in everything that is health and well-being. Today, we are really excited to welcome our guest speaker, who is a qualified urologist and a public health specialist whose dedication towards patient care improvement is truly remarkable. Our guest speaker for today is also an honorary lecturer at the University of Pretoria, where he trains the next generation of urologists. In today's webinar, you'll be speaking to us about all things men's health, offering practical tools and knowledge on how we can level up our wellness game. He brings with him a wellness of experience and expertise, and we are truly confident that you will leave with valuable and actionable knowledge. Please join me in welcoming Dr. Kevin Ramsamy. Dr. Kevin, the floor is yours.
Thank you for having me, especially all the attendees. I'd like to thank Pollard Health for hosting this. I think it's a topic that's not really discussed a lot, and men need to be empowered to making good decisions regarding their healthcare. And these sort of educational sessions are important for not only their clients but our patients and the general public. Just a quick introduction. I think you've done a great job introducing me. I appreciate that. Based in Johannesburg, South Africa. I'm a specialist urologist, and I do teach the postgraduates. So if I get a bit stuck in on the statistics, just bear with me. But it'll be quite a thought-provoking presentation. Sorry, give me 1 second. Oh, yes. So this presentation today is going to be a sort of a general overview of guideline on how men should perceive taking care of their health and suggestions on improving their health over their lifetime. There is one caveat to this. We must be aware that most of the research surrounding men's health or even healthcare in general is largely done in America and Europe. And so they largely have Caucasian populations. The research done in America on African American men tend to be, they describe them in their research as African Caribbean, because initially when men were taken as slaves along the coast of Africa, they were taken to the Caribbean and then went on to America. So they tend to represent a certain coastline in Africa. So just be aware that a lot of the guidelines are based on Caucasian men research, but it is better than no research. And currently Africa has a paucity of research regarding men's health and healthcare in general. And I'll go through the finesse and the importance of that when the time comes. So it's important that we create an environment where men feel comfortable seeking healthcare. I'll discuss that in a bit more detail later on. A lot of times, men don't actually seek healthcare. I've noticed in my practice when I asked patients why was there delay in seeking healthcare was, one, either they didn't have the knowledge, but two, there's actually a fear. And that fear is the inability to provide for their family if they have a diagnosis that could result in them being unable to take care of themselves and their family. So a lot of their concerns revolves around, if they make this diagnosis, how will it affect their ability to provide for their family? And it's important that we as men realize that an earlier diagnosis invariably means it's a lot easier to cure or resolve the issue versus a late diagnosis. So if you notice any of the concerns that we bring up in this talk, you rather seek healthcare earlier. If you have a good general practitioner, that's a good place to start, or you can consult a urologist. So some basic facts around male health. Men generally tend to live shorter lives than women, all right, on average. There are biological reasons, but I think most of the time it's behavioral because we tend to do more high-risk activities, all right? We tend to do the more dangerous jobs. There are more men that are working in mines than women, so they're more likely to be exposed to lung disease. So a lot of it has to do with how society is structured. So be aware that those sort of statistics are based off the fact of how men
Doctor,
are.
sorry,
Yes.
we can't see your shared screen. Could you re-share it?
Okay.
Oh, there we go. It's showing. Thank you
Oh,
so
yes.
much. Carry on.
All right. Sorry about that. In general, men tend to live, factually, men live shorter lives than women. But like I said, from my opinion and looking at the research, it probably has more to do with how we fit into society and our behaviors. More men smoke than women, right? Depending on which country you're in. We're more likely to get heart disease as well. But again, a big portion of that might be behavioral, and we need to look at how we can improve that. Why do men avoid doctors? As I said, in my practice, my perception or what most of my patients tell me is because of the fear of how they provide for their families. It comes down to how men identify. Most men identify as fatherly figures or the center part of the home, and their role is to provide for their families. So providing for their wives, their children, or their partners. And through that, that's how they define themselves. And so their avoidance of doctors tends to be a fear of finding a diagnosis that can change their ability to provide. So it's important to realize that earlier diagnosis leads to earlier resolution of the problems. And if it tends to be a hazardous diagnosis such as cancer, it's a lot easier to treat it when it's found earlier than later. That's the aim of this talk, is allowing us to find these diagnoses earlier so that we can assist you and actually cure them rather than being in a situation where they're incurable. Privacy concerns are an issue, but be aware that most countries, there are rules in place to protect patients and having their right to privacy protected. The other aspect around privacy is you can tell your health provider that you don't want them to contact your family members. And it could even be your wife. You could say that, you could tell your urologist, I don't want my wife to be contacted about this. Contact me, I'll decide when the time is to let her know what the concerns are. Regarding embarrassment around seeking healthcare, I think it's important to accept that it's normal to feel embarrassed when seeking healthcare for some of the problems that men have. However, it is important that you realize that you getting a service done, right? You need to treat this like going to fill up petrol in your car. It is something that you have to do. It is a requirement. If you don't fill petrol in your car, you can't go from A to B. So if you don't go and see this doctor regarding your concern, you're not going to identify the issue and you're not going to resolve it. And there may be something larger or problematic that's awaiting you if you don't find it early. We've mentioned avoidance of healthcare. I think the biggest issue with avoidance of seeking medical help is really the late detection of diseases. And what that results in is a difficulty treating the diagnosis when irreversible damage has occurred. Or for a great example would be if you screen for prostate cancer and we pick it up early, it's quite easy. Most patients who are picked up on screening actually have cure because they picked up very early in their disease process. But if you are picked up when you're symptomatic for prostate cancer, meaning you have backache, then there's a concern that it is actually metastasized and it's stage 4 cancer, which is more challenging to treat. So, and that then has a knock-on effect where it affects your social circumstances and your family. And, you're going to have a decreased quality of life depending what the problem is. The risk factors that affect men's health, we've got quite a nice list here. I think it's always important to divide these into two factors. They are the irreversible factors and the reversible or correctable factors. Irreversible factors is your age. All right, you can't change your age. You can maybe improve your lifestyle so that your biological age is better than your chronological age, meaning that you are a healthy 50-year-old rather than an unwell 50-year-old. But then There's other irreversible factors are your genetic factors, and then maybe where you were born or where you live. So you can't really, not everyone has the luxury of choosing where they live. All right, if you live near mine, you live near mine. You can look at your leadership to improving the environmental health, but that can't really be changed. And then we come to reversible or preventable factors, and these are things such as being overweight or obesity, which is a major risk factor for cardiovascular disease. It actually has a knock-on effect on outcomes when we're treating our cancers as well, or any other diagnosis you have. As you see later in the talk, it affects your erectile function as well. And then other chronic diseases such as chronic lung disease, smoking can cause that as well. But when you think about risk factors and how to improve them, you want to actually divide them into your irreversible factors and your reversible. And you really want to spend a lot of time identifying in your personal life what are the issues that you can reverse or you can correct that will lead to an improved outcome. Be aware, and a lot of my patients will, we tell them you've got to lose weight. They'll have this impression that they need to lose weight immediately. It's always nice to do that, and we all would like to do that. But a great example is me. I've been battling my weight my entire life, and I do a lot of exercise. It takes years to gain weight and become obese. So set a reasonable timeline that is manageable and expect to lose weight within that timeline. And something like smoking, everybody would like to stop immediately. But, if you look at the relapse rate of people that stop smoking, at 2 years, 2% of them are not smoking. The other 98% go back to smoking. So if you try and maybe steadily decrease your number of cigarettes per day or per week, you might actually find you might be able to stop it after a year or two. So it's important with a lot of the reversible factors to appreciate that it's not an on and off switch as much as we'd like it to be there. It tends to be a slow, steady fight, and over a year or two, you can actually reverse a lot of the problems that you have. It's important to focus on reversing them. Something like stopping smoking. Most of the damage that smoking has done that is not permanent, such as its effect on erectile dysfunction or fertility, can actually be reversed in 6 months' time. Cardiovascular disease is actually the hallmark of most patients and prevention of healthcare. All right. It is one of the highest causes of mortality in men and women. And it is something that we'd all like to prevent or have control of. We'll discuss how you screen for that later in this talk, but what it's important is also consider the risk factors and how we reverse them. I've gone through some of them. It's important to identify if you have hypertension or not, ensure that you are consistent with taking your medication so that you have control of your high blood pressure. Chronic diseases such as hypertension and diabetes, the concern is not so much the diagnosis, it is ensuring that you have control of your disease process. And this is important because a lot of the time we lose sight of the fact that we may have been diagnosed at the age of 50, but you actually had the problem for the preceding 5 years and you are undiagnosed. And in that time, there's some damage that is irreversible. So you want to spend the next how many years after the age of 50, after diagnosis, ensuring that your these factors are adequately controlled. If you're hypertensive, we've got your blood pressure under control with adequate medication and exercise control. If you've got high fat levels, we've adjusted your diet and we've considered giving you medications to control your your dyslipidemia, your high blood fat levels. If you have a stressful life, you've controlled those. So those are aspects we need to focus on. We always say prevention of cardiovascular disease. There's a lot of things you can do. I would say one of the hallmarks is to not smoke, right? Try to avoid alcohol use. And lastly, regular physical activity. The World Health Organization defines regular health activity as I think it's 20 minutes of steady walking or brisk walking 3 times a week. That's a bare minimum. And it takes into account patients that are also unwell to do more strenuous activity. What I always recommend to my patients is you want to target 20 minutes of running 3 times a week, right? If you do not like cardiac or cardio activities at the gym, considering do weightlifting as well and add some brisk walking to it, all right? One of the best exercises if you feel you're unfit and you're unable to do stuff at the gym is to consider using a treadmill and setting the, you walk for 30 minutes with an incline of 4 to 5%. And I think the rate is 4.8 kilometers per hour. It's actually quite a brisk walk for 30 minutes. It's quite a bit of a workout. It's used by a lot of weightlifters. There's actually a very nice and simple activity that leads to very little injury because you're literally walking for 30 minutes up a very gentle incline, but at quite a good pace. And as I said, our aim is to prevent mortality. When it comes to cancers, specifically in men, there are male-specific cancers, but be aware men can get just about any cancer. A great example of this is breast cancer, which is not in this list. 2% of all breast cancers are in men. And one of the recommendations is that if you have a family history of breast cancer, you actually do regular self-breast exams once a month. So you feel your breast, and if you notice a lump growing, your attended general surgeon will then consider a mammogram. So men do get breast cancer. So just be aware that it doesn't mean these are the only cancers you get, but and there are other cancers to be concerned of, but by and large, these are the main cancers. The most common male cancer, though, is actually lung cancer. And we're going to delve into more detail regarding prostate cancer and testicular cancer later and how we screen for it, and also colorectal cancer as well. These three cancers tend to have very clear definitions on how we screen for them. And so you may ask, what is screening? Well, screening is you're a healthy male, you have no evidence of the cancer in your lifestyle, and then you go to a healthcare practitioner or a healthcare provider. It could be a nurse or a general practitioner or a specialist, and they're attending to you for something else. For example, the general practitioner is seeing you for the common cold, and then they decide to do a test to make sure you don't have cancer. So an example would be doing the prostate-specific antigen or PSA blood test for prostate cancer. We'll go through that in more detail later in the talk. When it comes to prostate diseases, it is the second most common cancer in men. It is the second leading cause of cancer-related death, the first being lung cancer, and it tends to be cured. So before we started screening in the 80s, we tended to find a lot more men presenting with metastatic disease, meaning the cancer has spread through the body, and then you can't cure it, and the aim is to slow it down. After the advent of screening, we've actually seen what we call a disease migration. So there's been a switch where 80% of men were presenting with metastatic disease. Now we have 80% of men presenting with localized disease. So screening helps us find the cancers earlier, and it results in earlier treatment. There is some confusing research out there for doctors, and this is not for patients, where, there was an issue in America where the United States Preventative Task Force recommended against screening in a certain group of women with breast cancer, and also some patients with prostate cancer. For patients, that's not for you. That's for us. That's a research-based model. The reality is finding cancer does result in earlier treatment and probably great outcomes. So PSA is a cheap test. For example, currently in South Africa, the PSA test costs $10 US, which is accessible. And we recommend at least one lifetime test. So for $10, you can easily find the cancer and probably have an idea of what's going on and get early treatment. So screening saves lives. Don't listen to the research out there saying that it's not helpful. That's something for us clinicians and scientists to look at. But for the general population, screening is recommended, and it's just a safety. Now, what is benign hyperplasia? So in your prostate gland, it's the gland that sits between the bladder and the penis. The ejaculatory ducts, or the ducts that carry sperm, travel through them. So when you ejaculate, the sperm goes through the prostate and comes off the penis. This gland has a tendency to grow bigger as we get older. And all men will probably get some degree of it. And this is because we have testosterone. Testosterone stimulates the prostate glands. So testosterone is what makes us men. It gives us our erectile function. That testosterone allows the gland to grow bigger, and you get an enlargement, and it's benign, it's not cancer. And that can block the bladder and result in decreased flow of urine. It can also damage the bladder and the kidneys. So it's important when you're seeing your general practitioner around the age of 50 or your urologist to ensure you don't have benign prostatic enlargement. You can have BPH and cancer at the same time. That is relatively rare. You can have BPH in smaller glands as well that are symptomatic. All men are different. Each prostate is different. But that's the reason why you're attending a general practitioner or healthcare provider or a urologist. It's for us to guide you through that process of accessing care and knowing what the next steps are. Generally, what we recommend is if you have decreased urine flow, you should attend a general practitioner who will consider a urological consult. And if you do have BPH, you do need follow-up once a year or every 2 years until you pass away of old age, I'm afraid. Prostatitis is actually another relatively common disease. It's probably picked up more often now because of PSA screening. So that blood test I mentioned for prostate cancer, which we'll discuss in a bit more detail later on, it tends to go up. And one of the causes is either benign prostatic enlargement, prostatitis, or prostate cancer. Actually, the most common cause of the PSA being high is actually prostatitis, not cancer. And it tends to be benign disease. But our job is to exclude a cancer because that's what everybody fears when they see a doctor. Do I have cancer? Is cancer causing my problem? And really our role is to make sure that's not the issue. Prostatitis and benign prostatic enlargement and stage 1, 2, or 3 prostate cancer can be easily treated. So it's important to pick up these diseases early and manage them. When it comes to the other sphere of men's health, which is sexual health, we know that about half of men will experience erectile dysfunction in their lifetime. A lot of men will actually experience premature ejaculation. Just be aware the 1 in 4 statistic is a bit high, and it's dilution because a lot of men have a false sense of what a normal ejaculation is. The average man in the world, if you look up the research, has an ejaculation between 60 seconds to 2 minutes, so it's about 90 seconds on average. Most men can actually go 5 or 10 minutes. And what most men tend to notice is that what they call premature ejaculation is not true premature ejaculation. They just tend to become more unfit, so they can't last as long. True premature ejaculation is when it's under 90 seconds. And if it's a relative premature ejaculation where your performance is less than what it was, be aware it may be evidence of underlying cardiovascular disease, which we mentioned earlier, or it may be your poor lifestyle, and we've got to look at correcting that. A good general practitioner or a urologist will guide you with that. Male infertility, we actually account officially for 10% of all infertility cases, but we actually probably have a higher percentage, that was, we say, about half of cases of difficulty achieving pregnancy. Male infertility is a big concern. And I think especially with how we tend to focus more on our careers, and a lot of us are professionals and we tend to have kids after the age of 35. What happens after the age of 35 is that testosterone naturally falls in all men. So of course the sperm quality will decrease. So men can have a child throughout their life. Even till the age of 90, you can produce sperm and you can father a child. However, be aware that testosterone does fall. You do have men who are statistical outliers who are fortunate where their testosterone is amazing at the age of 80 or 90. But by and large, according to big, large-scale studies like the Massachusetts male study, that's one of the hallmarks for testosterone, showed that testosterone fell after the age of 35. So when it comes to male infertility, it's important to know when to seek help. If you're younger than 35 and you haven't had a child after 1 to 2 years of trying without contraception with regular intercourse, then we recommend doing a sperm analysis and attending a urologist or fertility doctor. If you, after the age of 35, use a cutoff of 6 months. And the reason the cutoff is 6 months is time is not on your side. Because not only do we have to focus on assisting you to have a child or improving your sperm, we've also got to look at improving the quality of your wife's eggs or assisting her to support a pregnancy, or let me say your partner. Male infertility is a whole topic on its own. I won't spend too much time on that. So let's talk about testosterone. You know, everyone says this word. We know there's men using it illegally at the gyms to look amazing. It's an important hormone. A hormone is a particle that floats around the blood produced by glands in the body, and they have specific effects throughout the body on certain tissue. So we define a low testosterone, according to the American Urology Association, as less than 300 nanograms per deciliter. But in Africa, we tend to use the European Association of Urology measurement, which is less than 12 nanomoles per liter. It's important to note that it depends what the lab is using, all right? There are different assays, and so they will generally have a guide with their testosterone test on what they define as normal. But this is by and large the accepted definition. The next thing is there's an odd thing about the testosterone research and statistics. There's no actual normal testosterone. We don't have an upper limit. We just know that below a certain number, men start having problems. So if I have a man that has a testosterone of less than 16 nanomoles, he doesn't meet the criteria of low testosterone. But if he's got the side effects of low testosterone, which I'll go through just now, then he meets the criteria for receiving testosterone therapy. But generally, most men will be symptomatic when the testosterone is less than 12. Low testosterone causes, there's a long list. I could have put a nice busy slide here, but you've got to keep it quite simple for most people to understand. It's that there's either a problem in the testicle itself producing testosterone. For example, you've had an infection that has damaged the testicle, such as mumps. You've got trauma to the testicle and you've lost your testicles or one testicle. Or there's some other disease process affecting the testicle, decreasing production, such as testicular cancer. The other is testicular stimulation. So there's actually a pathway through the body for the hormone to be secreted. There's a little gland in the brain that secretes a hormone called prolactin. And if you have something called a prolactinoma, it actually increases prolactin, and through this pathway decreases testosterone in the body. There's a certain pattern we look for testing for this, and then we'll do an MRI of your brain if you're worried about it. So don't stress about that. But those are the two. The third mechanism is a lot more uncommon. It's actually relatively rare. And this is where you have receptor dysfunction. So you have something called the androgen receptor. Testosterone binds to this in target tissue, and you may have a receptor where the receptor is abnormal and the testosterone can't bind to it. That's very rare. It tends to be a genetic problem some people are born with, so don't worry about that too much. If you're getting good erections from the age of 16, that's probably not going to be your problem. It's either going to be a production issue or a stimulation issue. Another concept that has come through recently in men's health is the concept of late onset hypogonadism. This is where we have a patient who's above the age of 35. They have the persistent symptoms, which I'll go through just now. And they have this low testosterone and we don't find the cause. So in other words, we scan your testicles with an ultrasound, we do the blood tests, and for some reason, your testicles are not making testosterone, but they look like healthy testicles. And there's no history of any disease process that damaged them. In that case, you are defined as late onset hypogonadism. And then we give you treatment to support you through that, to assist you to resolve your symptoms. Just briefly on the symptoms, it's important that if you have these symptoms, you seek a healthcare provider, because the aim of managing a man with low testosterone is to exclude anything that'll kill him. Cancer. That's what we're all concerned about after the age of 40. And once we've excluded anything lethal, we then focus on what can we do to improve it. So is it going to be lifestyle modification or is it going to be drug therapy? And it's important that if you have any of these symptoms, you consider seeking healthcare, and then we evaluate you. We make sure there's no prostate cancer, there's no testicular cancer. Later in the talk, you'll find that testicular cancer is considered a disease of young men. However, older men do get testicular cancer. So it doesn't mean you don't have it, and your provider, your healthcare provider, has to exclude that. So in general, we divide the symptoms into sexual, physical, and psychological. I know some people say sexual is physical, but it's just an easy way of remembering it, all right? So the sexual characteristics are, you have problems with ejaculation, you struggle with your libido, you have a low libido, you struggle to get aroused, and you actually notice that your morning erections are disappearing. The morning erections decreasing is actually the earliest hallmark. The next is your physical health. You have less strength and you have less energy. The less energy is actually quite subtle, and most men actually probably have it to some degree. You have a man who's been listening to his wife for about 20 years. They've been married 20 plus years. He's been taking out the trash every day. And then suddenly he doesn't have the energy to go and take out the trash in the evenings. That's a sign that he has low testosterone. The moment the man has a sort of lethargy or less energy to doing the things that he had no issue doing before, it's highly suggestive of a low testosterone. And one should consider seeking a healthcare provider's assistance with that. Other aspects that present as low testosterone is the psychological part, which is where you have low mood and motivation. You feel tired all the time and you have low concentration. Again, this feeds into the lack of energy. We as men need testosterone to drive our libido. We need testosterone defines us. It allows us to get our erections. A lot of men are defined by their erections. If you don't get an erection, you don't feel like a man, you can't satisfy your wife. So it's important to notice that this is happening and then seek healthcare. When it comes to testosterone therapy or how we treat it, remember this is a general guide. It's not full medical advice. You need to see a healthcare provider and we individually decide in you what needs to be done. There are non-specific and specific ways we treat this. All right, this is how I define it. It's an easy way of remembering it. Non-specific things are to improve your cardiac function. All right. It's important to make sure when you have symptoms of low testosterone that we're not actually dealing with concomitant cardiac disease. Half of men who have silent cardiac disease have low testosterone or problems with their erections. So the non-specific techniques of improving your testosterone will be exercise. By increasing your muscle mass and your activity, you will naturally stimulate your testosterone. You need to stop any chemicals. Chemicals are easy. Smoking. If you vape, don't vape. Vape is a bad idea. I know people see it as a replacement for smoking. In a strange way, I'm going to say something very unpopular. Smoking is actually safer than vaping, but you shouldn't do both. Why? Smoking, we know who will get lung cancer. We know the incidence of lung cancer. Vaping is something new. We only had it around for 5 or 10 years. We don't know who gets cancers. There are rare diseases coming out now from vaping called popcorn lung. You don't want to be stuck with a disease that we don't really know what we're dealing with. So my advice is just stop all chemicals, right? Smoking, we already get enough chemicals in our body when we breathe through the exhaust of cars when we're driving around. So last thing you want to do is add something like smoking and vaping to it. You need to improve your diet, all right? You need to eat cleaner. You need to have less processed foods, also less barbecued foods or grilled foods. We only recommend 1 serving a week. A nice simple diet to follow is you use your hand, right? Your carbs should be the size of your hand, your fingers and your palm. Your vegetables should be the size of your palm, and your meat should be, or your protein should be the size of your palm. Try to have fish 1 or 2 a week. It's a healthy substitute for most of our protein. I know it's not easily accessible in Africa, right? Depending where you are, if you're not on the coast. Regarding the type of diet that suits you, again, that sort of has to be individualized depending what your circumstances are, if your aim is to lose weight or not. So you really, if you do have a weight issue where your weight is high, you have a high BMI or body mass index, I would highly recommend you consider seeing a healthcare provider. And like I said, we treat the underlying cause. Most of the time, we don't actually find a cause for low testosterone in most men. The next specific interventions is improving cardiac function. So let's say you come in, we realize you have cardiac disease, we send you to a cardiologist and they consider stenting of your heart to improve the function. Next, we will give you testosterone. It's very important that if you're considering taking testosterone, consider taking it with a doctor or a healthcare provider and not at the gym, right? And the reason for that is we can control the dosing. If you take someone from low testosterone to normal testosterone, they're very unlikely to have the complications of taking testosterone. Whereas if you go from normal to supernormal or high, remember there's no definition of high, then you're more likely to complicate with the side effects of testosterone, which is like mood disturbance. You're aggressive for no reason, you're easily triggered. So get it done by a healthcare provider. Next important caveat, which a lot of clinicians are actually not aware of, so please take note of this, is that if you're planning children, you are not for testosterone replacement therapy. It actually suppresses the sperm, and that suppression of the sperm takes 6 months to 5 years to actually naturally correct itself. And there's very little treatment to improve it. So if you're considering fertility, we should not be giving you testosterone, and we should be considering something called gonadotrophin therapy. But like I said, you've got to be very understanding that if you take exogenous testosterone, with exogenous meaning an injection or a cream or something from a doctor, that it will suppress your sperm count. So being clear on whether you want fertility or not is essential. When it comes to the mental health of men seeking healthcare, It's always a side sort of discussion, but it's actually very important. We actually take a lot of stress. We're told not to talk about the stresses we undergo in our life. And it actually does affect a vast majority of men. 1 in 10 men actually suffer from significant stress, all right? We tend to be at higher risk of suicide because whereas women, sorry for this generalization, tend to pick softer suicide methods such as overdose, men tend to be more aggressive and they're more likely to take a gun and just shoot themselves in their head. So the suicide risk tends to not only be higher, it tends to be more lethal. Men tend to go more permanent when they're attempting suicide. So it's important that if you're struggling or you need assistance, that you seek mental support by seeing a psychologist or psychiatrist. If you feel there's a barrier to accessing that, you don't want to get a label. Maybe you work in an industry like you're an attorney and you can't be identified as having a mental health illness or some other reason that you can't be defined because let's say just seeing a psychiatrist provides a label. That's another concern a lot of men have, that their work will be affected by it. I would recommend you start with your religious leader. If you have an imam at your local mosque or you have a pastor, if you attend that person and you tell them about your concerns, they'll give you guidance. And sometimes just talking through the problem might be enough to assist you through that. And through them, you can find someone where you can have the reassurance that your privacy is maintained while getting care. All right. Men tend to have a very high dependency rate. I think we're all well aware of that. I'm sure you know many friends and colleagues, if it's not you, that are smokers, that drink alcohol, hopefully are not using more stronger drugs such as heroin and cocaine. So substance abuse is significant. And there is support out there. But the first step is deciding you need support. And if you feel going the route of seeing a healthcare provider is not accessible, I always recommend you start with your local religious leader who will guide you through that. All right, so what is the urologist's role in male health? We also see women as well, by the way. So we will see your wives if there's an issue. We treat the kidneys and the bladder as well, and women have those. But we are seen as the male gynecologists, all right? We take care of men's reproductive organs. With the person you come to when there's a problem with your scrotum, testicles, penis, erectile dysfunction, and any issues with the urine flow, all right? What's the subtlety of the urologist is we do manage kidney failure, but kidney failure and its underlying treatment tends to go with the nephrologist, who is a doctor that treats the medical diseases of the kidney and does dialysis. And most urologists will focus on anatomical disease. In other words, we are surgeons, so most of us operate as well. So if you have got a cancer of the kidney, we remove the kidney. That's a very simplified explanation. In men's health, we actually do focus on a few things such as the prostate health and male sexual dysfunction. But it's important to note that prostate health also relates to something like benign prostatic enlargement and how it affects your kidneys as well. So there's a knock-on effect. So I would say how we should define a urologist is that our job is in terms of protecting the kidneys. Our aim is to anatomically make sure there's no blockage to urine flow and that your organs for reproduction are working normally. They are pediatric urology. Pediatric urology is actually shared amongst two specialties. It's shared by urologists that specialize in pediatric urology and general urologists, and it's managed by pediatric surgeons who have an interest in pediatric urology. They tend to be a bit more highly specialized because the congenital malformations means a child's born with, let's say, 2 kidneys or an absent kidney, or the penis is not normally formed. It takes a lot more skill, and you need someone that has done a lot of those procedures. And so that's what we assist you. But start with a general urologist, and if there's an issue, we'll take it from there. Our role in children, we tend to get referrals from pediatricians, all right? So most children will start off with a pediatrician. When they've detected an abnormality, they'll then refer across to us, all right? So malformations means that, let's say your child has a physical attribute that's a problem. For example, they've got what we call a duplex kidneys. They've got 2 kidneys in there on one side. So they've got a total of 3 kidneys. Or they've got something called a hypospadias, where there is a abnormality of the penis and we need to reconstruct it so it looks like what is a normal looking penis according to societal standards. We also manage bedwetting, that's persistent past the age of 5 or 6 years. It's important that you start early with that if it hasn't occurred. It's a lot easier to work with the child as they're growing up than trying to fix something when a child is 12 years old. So early referral is important to urology for enuresis. Infections. In general, our perspective from urology is this. There's mixed research around this. Infections will be diagnosed and treated by your pediatrician by and large. Most pediatricians will consult us when there's one or more urology infections. But according to urologists, no child should be getting an infection of the urinary tract. So if your child gets a urinary tract infection, that's an infection of the bladder or the kidneys, they need to consult a urologist within 3 months. Our role is to then decide, is this being caused by something they're born with, a congenital anomaly, or is there some other issue we need to resolve? And of course, we do handle urological emergencies. You'll be surprised how often a child injures their scrotum or their penis while playing. It's quite odd. Our role in adulthood, I think I've gone through that quite extensively earlier. One thing we haven't discussed earlier is screening. All right. So screening can be done by your general practitioner, but we also assist with screening. And of course, our knowledge on screening is a bit more finessed and how to manage that. When to see a urologist urgently, this is not an exhaustive list. I mentioned the issues surrounding low testosterone. Any blood in the urine that you see needs a urologist to consult you within 1 to 3 months. Even though the risk of cancer is relatively rare, it's 5% after the age of 50 of cases that have blood in the urine, it is an important diagnosis to exclude. So generally, if you have blood in the urine, you can expect your urologist to do an upper tract imaging with a CAT scan of the abdomen or ultrasound. CAT scan tends to be more useful, and we will probably commit to doing a cystoscopy, which is an evaluation in theater, where we put a camera when you're sleeping into the hole at the bottom and look around the bladder. Be very careful if you have blood in the urine and there is no pain. So painless hematuria is a very important hallmark of possible cancer. We are fortunate in Africa that a lot more of the time that's caused by a infection in the bladder by a parasite called Bilharzia or schistosomiasis. But be aware, painless hematuria, you need to see a urologist within a month. All right, you tell them it's urgent, they'll make a plan and squeeze you into their consultations. If you get severe pain, just above the pelvic bone or in your back, it may be a sign of kidney stones or bladder infection. And note that kidney stones can also be caused by a dull ache. So if you tend to have pain that's on the side of your abdomen, on your flank, and it tends to go down towards your pelvis, that tends to be a kidney stone. You may or may not have blood in the urine, and it could also present as a dull ache over a number of months. Generally, you'll see your general practitioner, and they can order an ultrasound and make a decision from there. Testicular pain, if the pain is less than 24 hours, you do not need to wait for your urologist. You need to attend the nearest emergency department where the doctors will assess you there. Our biggest concern with acute testicular pain less than 24 hours is a relatively uncommon disease called testicular torsion. This is where the testicle twists on its blood supply and it dies. And if it dies after 24 hours, we have to remove it. So that's a very important diagnosis. So if you have testicular pain less than 24 hours and it's severe, it's probably the worst pain you've had in your life, then you know you've got to see an emergency unit as soon as you can. It's not a situation when you book to see a doctor. You go to your nearest emergency department or GP, and they will assess you and make a decision from there. Thankfully, most of the cases are not an acute testicular torsion. They tend to be things such as infection and maybe injury to the testicle. Lastly, urinary retention means you're unable to pee, right? It tends to be more common in the older men. Most patients know they can't pee and they'll immediately come and see us. They know something's wrong. The pain is very dramatic. So with the urinary retention, I think most men will easily come in, but be aware, testicular pain, a lot of men tend to ignore it because they're busy with other stuff, as odd as it sounds. And lastly, the painless hematuria tends to get ignored from bladder cancer because you think, oh, it's resolved, I shouldn't really worry about this. Then suddenly you bleed again in 3 months. So frank hematuria or blood in the urine that you see, you need to see help as soon as you can. Okay, so what's a medical checkup? It's that definition I explained to you all earlier called screening. In other words, you're going to see a doctor and they're screening you for general health conditions. So in general, I've got a urologist perspective, but we will start with a general perspective and then show you the specific things we as urologists look at. So this is a nice table we've put together. It is quite busy, so if you can take a photo, I'd highly recommend it. So generally how I divide or how I teach our specialists to look at it is you divide your screening into what the patient can do at home, what we do at the bedside, and what the laboratory test that we do. And in the laboratory, we might put things such as imaging, all right, and a few other tests. So generally, we'll divide it according to age group. I think Hollard had a very nice approach dividing according to these age groups because there's some overlap with the ages. It just depends what you're looking at. In general, if you have a child and they need healthcare, it's important to remember if there's acute testicular pain in a young boy, you take the child to the emergency unit as soon as you can. All right, because that might be the ball twisting on itself. It tends to occur in a child between the age of 8 and 16. That's because they suddenly get a rise in testosterone, and that causes the testicle to enlarge, and then it twists on its blood supply. What's important that most healthcare practitioners will check is that your vaccinations are up to date, right? And a very important thing as a father or as a caregiver to note is your child struggling at school? It's a very subtle thing. The second thing is maybe they're sitting too close to the TV. They don't sit close to the TV because they love the show. They sit close to the TV because they can't see the screen. So if you have a child that's sitting very close to the TV screen, it's important to take them to an optician to get their eyes tested. They may actually need glasses. It's actually more common than you think, being nearsighted or farsighted. And lastly, if there's slow progress at school, that's also a hallmark of possible eyesight issues, because maybe they just can't see the board when the teacher's teaching. And because of that, they're actually lagging behind. That's actually my personal story. I actually struggled in school until I got glasses. And then dietary issues. It's a very subtle thing, but if a child is struggling at school, don't be surprised they're not getting adequate intake of the correct food. Just because your child's well fed doesn't mean they're eating good, because maybe they're just not having enough fruits and vegetables to allow them to grow and to have their brain to function. At the bedside, what your healthcare provider will do is they'll take the height and weight of your child and plot it on a growth chart to ensure your child is following the normal trajectory of growth. If they find the child's not growing according to the normal trajectory, this is usually done every 3 to 6 months in the first 2 years and thereafter once a year. Then we will, of course, have to intervene and figure out why your child is not growing normally. Of course, if both parents are short, then probably it's going to be genetic, but by and large, most of the time, we'll actually pursue it and figure out what's going on. It's important in childhood to figure out if both testicles are in the scrotum. There's an entity called an undescended testicle, where the testicle fails to descend into the scrotum. It's important we try and bring the testicle down, ideally before the age of 2, but if possible before the age of 12, because the actual ability for the testicle to make sperm decreases after the age of 2 years old if it's not in the correct place. All right. Also, they are at higher risk of testicular cancer, and because it's in the abdomen, if they get testicular cancer later in life, they'll tend to present very late with symptoms, whereas testicular cancer is actually very easily cured when picked up early. We will then proceed to do a general examination, check the eyesight, the hearing, etc. And in general, most pediatricians will probably do a yearly or every 2 years, do a blood count and a lipid profile if overweight, but most children don't need any blood tests. It's actually very rare to find abnormal blood tests in children if they don't have problems with growth, etc. Then between the age of 20 to 40, most men probably don't come in for checkups. It's important to do regular monthly self-testicle exams. And if you notice any lumps that you feel on your testicle, then you attend a healthcare provider. You can look up a general YouTube video on how to do the self-testicle exam. And it's recommended that you actually do it after a hot shower, because the testicle actually drops into the scrotum. If you attend a healthcare provider, we'll generally do your blood pressure. Important to check your fasting blood sugar to make sure you're not diabetic. And then we'll sometimes check your urine protein and work out your body mass index to see if you're overweight. Blood test, blood test, the PSA is a bit of a gray area one. It should actually say 45 there, but it depends. So the testing for or screening for prostate cancer, classically, we used to say you had to have a rectal exam and you had to do a blood test. The newer research says you can substitute the rectal exam for the blood test. My advice is do both. If you're comfortable doing a rectal exam, then your provider does a rectal exam and the blood test, because you can have a normal blood test with a cancer that can be felt on the prostate. That's very rare. The next important thing is that the age of testing, it depends. If you can only afford one test in your life in a resource limited setting, maybe you don't have access to doctors, then you do one test at the age of 50. Remember, if you're sick, testing the PSA is not screening. We are checking for actually excluding prostate cancer. Screening is when you don't have any issues, all right? The next the age of screening is, we recommend that if you have a family history of breast, endometrial, and ovarian cancer, so that means your mom or someone had ovarian or endometrial cancer or breast cancer, then we recommend testing at 45. If you have a family history of someone having prostate cancer at a young age, so between the age of 20 and 40, then you should test at 35. If you have a family history of, so you've proven to have a genetic test called BRCA that's positive, you should start screening from the age of 40 and have a yearly PSA thereafter. So notice that it's 50, it drops to 45 if there's a family history of breast, endometrial, or prostate cancer, and then it drops to 40 if you have a genetic mutation called BRCA. This is important. In Africa, we don't have easily accessible BRCA testing. The BRCA test, for example, in South Africa costs $3,000. A PSA test costs $10. It's cheaper for most men to just do a PSA at the age of 40. We know African men tend to have more aggressive disease. We know it's dangerous to just take research done in Caucasian men and transplant it to South Africa or Africa. So the recommendation to most of my patients is actually consider, if you're an African man and there's a family history of any of those cancers I mentioned, breast, endometrial, ovarian, or prostate, that you actually start testing your PSA from the age of 40. So be aware of the finesse. If you can afford BRCA testing, go for it. But if you can't, then it makes sense to just do a $10 test once a year, once every 2 years, then spending $3,000 on BRCA testing. The next thing is, when you other tests that will be done if you're in that age group, it's important to consider one lifetime test for hepatitis C. And also in young men, we're living our lives. Please consider HIV testing and making sure you don't have syphilis. All right, syphilis tends to cause a lot of long-term damage if it's not picked up early, and it's easily treatable when it's earlier. Please use condoms when you're a young guy, even older guys. Everyone should just use condoms if they're not having one regular partner. If you're 40 plus, again, we recommend the regular or monthly breast exams. You can still continue the testicular exams, but that's not really a recommendation in the guidelines. And of course, we'll also do bedside tests such as blood test, blood pressure. It's pretty much the same as when you're 40 years old. What's different is I'd recommend most doctors do a rectal exam for you to check your prostate. What changes in the guidelines in terms of after the age of 40, we'll come to that in more detail later, is you should actually consider your thyroid and vitamin D levels testing. And also you can then introduce HbA1c testing for diabetes. Okay, other tests that we will offer patients after the age of 40. We recommend that most men have a colonoscope from the age of 45 years onwards and every 5 years. Note that this changes if there's a family history of colon cancer or gastric cancer. Then your gastroenterologist or general surgeon will recommend a colonoscope every 2 years. It also depends if they find polyps on the first scope or if there's abnormalities. So be aware of that subtlety. So it's not a hard and fast rule that it's every 5 years. There are newer tests available in high-income countries such as fecal occult blood and a stool DNA test. I don't think they've been improved as far as I know in Africa as yet. We recommend most men have a dental exam every 6 months. If you can't do it every 6 months, then once every 2 years is adequate. It's important to pick up issues early so they can just, if there's a carie, they can easily fix it in your teeth. We recommend an eye exam every 2 years. Once again, the one lifetime test for hepatitis C, which most doctors don't know about. And then lung cancer screening is if you're a smoker, right? It really comes down to if you have risk factors. In other words, your age, is 50 to 80 years old, you've got what we call a 20-pack year history, or you currently smoke or you've quit within the last 15 years, then you need to undergo lung cancer screening. And that, depending on the local circumstance, will be either a chest X-ray, which is the most common type, or they might do a CAT scan of your chest. If you have a family history, that might increase your risk and they might do it sooner or more often. Osteoporosis screening, it's not as common in men. It tends to be when you're much older, when you're 70 plus. It tends to be more common in Caucasians rather than non-Caucasians. So be aware of that subtlety as well. If you've had the following risk factors, we recommend that you do osteoporosis screening, which is that you've been using long-term steroids, either prescribed or off the counter or at the gym. You've got a low body weight, you're a smoker, and if you've had heavy alcohol use, all right? And if you've had a fracture after the age of 50 years, then we start worrying about that. But most orthopedic surgeons will refer you on to that. Skin cancer screening, it's more common in Caucasians, but non-Caucasians do get skin cancer. It's important that if you've got a prior family history of skin cancer, or you've had prior skin cancer, or you've got immune compromise such as diabetes or HIV, or you've had excessive sun exposure, you work a lot outside in the sun, that you consider you having a yearly check of your skin. It doesn't have to be by a specialist doctor. It can be by a general practitioner. You can have your partner just look over your body and notice any spots, and then you can highlight that spot to your local provider. Okay, so practical actions, we mentioned improving the diet. The recommendation is 5 portions of fruits a day. Most people can't achieve that. Let's be honest about that. I've tried. It's actually very challenging to have 5 portions of fruits and vegetables a day. So be a bit more realistic with that. I recommend finding a good multivitamin that can assist you, and try to aim for a practical 2 or more portions per day of fruits and vegetables, and try and have at least 5 portions 3 to 4 times a week. It's, when you really think about it, it's very impractical to have 5 portions of a day for most people. It's also very costly as well. Fruits and vegetables in South Africa, fruits and vegetables is cheaper than meat, but if you're in a high income country, fruits and vegetables is relatively expensive. So that's why they have more processed foods. Also, we recommend regular physical activity. I've discussed that before. Try and get a full night's sleep. You'll be surprised how much energy you have if you get a good night's sleep for 8 hours. The target is 8 hours. You actually feel more tired if you sleep more than 8 hours. And one trick to having a good night's sleep is what we call practicing sleep hygiene. You sleep at the same time every night. Try and avoid having any chemicals after 2 p.m. such as caffeine or alcohol and smoking. And the other aspect to a good sleep hygiene is that you try and ensure that you have a slightly cooler environment. So if the room's a bit more cooler, you're more likely to fall asleep, all right? The target temperature for good sleep is 21 degrees or 21.5. Try to do regular exams and checkups with your health provider, and I think you'll have a good outcome. We've gone through a lot of these things. We've gone in detail into this. I'm not going to spend time on this. My advice to a lot of men is that the one thing you can't buy, well, you can sort of buy it, is time, right? Yeah, you can buy time by just paying someone to do something for you, and then you have more time for yourself. But you can't buy back time, and you can't buy back your health, no matter how much money you have in the world. That's where we all are equal, is on that last day, right? And it's important that you realize, as busy as you are in your lifestyle, if you're in a corporate environment or you're non-corporate, and that you do set aside time to take care of your body. So aside from paying you, so in finance, they'll tell you pay yourself first before you pay your debtors. So put your savings away first. So in the same way, pay yourself first by going to gym, eating healthy and taking care of yourself. You don't have to be perfect. Very few people can live the perfect life where they're doing all these things all the time. But try to get there 80% of the time, and you'll find that your overall health will improve, and you'll actually feel great. When you can walk up 5-10 flights of stairs without catching a breath, you actually feel really good. All right, if you have any questions, you're welcome to ask them now, or you can contact your local physician or urologist. Thank you.
Are there any questions from our audience? Is it dangerous if I feel hot every day?
Okay, so firstly, when you're feeling hot today, danger is a bad word. I think that it could be a sign of underlying thyroid disease. So there's a gland in the neck called the thyroid gland, and you could have hyperthyroidism. So it's producing too much of a certain hormone called thyroxine, and that's resulting in you having this sort of hot flushes every day. It may be other things as well, and maybe also it could be that you're overweight and that's causing it. But it is something that you need to attend a general practitioner for, and then they'll assist you with that and evaluate it. So if you had attended me, we'll start with a general history, find out when this is happening, do a general physical exam, do our basic screening, and then actually do a thyroid function test to ensure there's no issues. Right. Hope that assists you. Yeah. Oh, so I see there's a question from Mr. Benjamin Matthias. He asked for the recommended sleeping temperature. I'll type it out. It's actually 21.5 degrees Celsius. So that's, I don't know what the calculation would be in American. So I think you'll have to work that out. But I think that's most humans are actually very comfortable at 21.5 degrees. And then you'll find that if you set your car temperature at that, you actually feel very comfortable. And then you might feel overdressed or underdressed depending on you. Yes. So we always recommend starting with natural ways of improving testosterone. This is for Mr. Samuel Okine. We mentioned the exercise. We're mentioning exercising cleaner. All right. Sexual activity will also improve your natural testosterone. So have more sex. I think most men will appreciate that recommendation. And then the other aspect with medications is there is testosterone replacement therapy. I won't discuss gonadotropin replacement. And the options will be between, we have the options of a 3-monthly injection, a 2-weekly injection, or there's a cream. Each one has different cost profiles. So really your health provider will guide you that in your local circumstance. So it has to be sort of tailor-made on your lifestyle, what you can do practically and what you want to achieve. Most men will probably get the 3-monthly testosterone undercoat injection because it's easily manageable, right? Hope that helps you, Mr. Okine. Next is Mr. Martin Ingila. Which foods are good cleansers of body or blood cells? Oh, okay, all right. Cleansers is a tough one. I think there are things we believe in different cultures. You're welcome to follow that. What I would say is, having a high fruit intake is important. So that 2 to 5 fruits or vegetables a day is crucial. They actually have something called, so they have a lot of vitamins, and those vitamins act as free radical scavengers. So all the time your body is creating these things called free radicals in cells, and some cells die. And naturally you clear out the cells. Those free radicals are actually theorized to cause some cancers as well. And when you have a high fruit intake, it has a lot of the vitamins and minerals in them, and those act as free radical scavengers and decrease those oxygens. The oxygen is a bad word, but we call them free radicals in the cells. So just increase your fruit and vegetable intake. As I recommend 5 a day, but I said practically that's not always possible. Hope that helps you, Mr. Ngila. Mr. Jonathan Saku, which of these male tests recommended is covered by Holland on the insurance? What I would recommend is, I'm unsure if Holland will respond. Perhaps you should contact your local insurance provider. That's what I would recommend, and give them your specific plan, and then they'll tell you. Most screening tests are covered by all medical aids. Interestingly, they cover it because they do care about your healthcare, but it's also a numbers game. They're business, they're a company. And if they find these diseases earlier, it benefits you, but it's also cheaper for them. For example, the treatment of localized prostate cancer in South Africa in rand terms, or I'll convert it to dollars in my head, is probably around $10,000 to $20,000 once off to cure prostate cancer. To treat prostate cancer that has spread, the cost escalates to about $100,000 a year. So it's cheaper for the most insurance providers to find these cancers earlier. So screening is a big part of what they do. So they'll be more than happy to assist you. But you've got to check with your individual plan. And that's why Holland is doing this, because if you have a good outcome, they have a good outcome. All right? Because you claim less and everything. So they want you to find your diseases early so we can treat them early. Is there any health consequence if you're not married after 38 years old? No, marriage is a cultural construct. You're welcome to be married or unmarried. I would say, is there any health consequences with fertility after the age of 38? So what we know is after the age of 35, your testosterone will fall and it becomes more challenging to have a child. So what I would recommend is after the age of 38, you be very clear if you want kids or not. And if you do, then you need to, and if it's important to be married first, then you've got to try and get married to have a child. But being married is not a prerequisite to have a child. So it's important to be very clear as a man after the age of 30, when do you want fertility and when? Because you will struggle as you get older. It can be done, and most men don't actually need support. But when you're in that group that needs support, it can be quite challenging. So that's the only consequences of not being married after 38. The other consequences, you actually have freedom, but that's a different discussion. How can we raise testosterone levels naturally? I've discussed that previously for Mr. Okine. There's a rumor that having sex 3 times a week may help to ward off prostate cancer. Any truth to this? Actually, yes. There's actually a study done where they said that men that ejaculate more often are less likely to have prostate cancer. So it is actually a recommendation. It's known that men that have more sex have less prostate cancer. But look, I don't think it's something you should stick with. I think prostate cancer, unfortunately, tends to be more a genetic disease, right? So if you're fated to get it, you're probably going to get it. There is some evidence that eating tomatoes can prevent it, but you have to eat like crates of tomatoes weekly, which is not going to happen. And there's also that this ejaculate more often. I think you can have sex to have a child and have fun, but don't think of it as a way to prevent prostate cancer. The way to prevent prostate cancer, unfortunately, is to do screening from the age of 40, 45, or 50, as I've explained. Pick it up early and address the issue. That's based on my interpretation of the current research, right? What is the impact of masturbation in men? Okay, so there's 2 aspects to that. So firstly, some men will get erectile dysfunction if they masturbate. That's because of if you're watching pornography, you get a false sense of what sexual intercourse is like. So your perspective on sex changes. And so when you're with your partner, the sight, sounds, and smells don't stimulate you. All right. So it's a psychological impact on your erectile function. The second impact of masturbation is that it's very rare, but you can actually injure your penis. But that is found in a very select culture that does something else when they do it. So don't worry too much about that. But by and large, masturbation from a clinical point of view has no negatives. Cultural and social, those are different aspects out of my scope of practice. Right. There's no other questions here. We have run over for 10 minutes. All right. Thanks for having me. And I hope we've improved the healthcare of many men out there. And just remember to go and get help. All right. Go get screened. Yeah, you deserve better. And it's actually to take care of your families. All right. All of you take care. Thank you.
Thank you all for joining us today. And a special thank you to Dr. Kevin Ramsamy for that insightful and practical session on men's health. Just a reminder that this recording and presentation will be made available on the All That Health website. So please feel free to visit the session or share it with your colleagues. We also inviting you to join us for our next webinar on the 10th of July, where we explore how you can optimize your health with our Teladoc services. These services are free for all Wallet Health members, and they give you access to doctors and second medical opinions, no matter where you are. Until then, stay well, take care.